Rachel Coleman with Being Health, and joining us today is Dr. Alaba Robinson. Welcome, Dr. Robinson.
Thank you for having me.
Absolutely. Can you tell us a little bit about yourself?
My name is Alaba Robinson, and I'm an internal medicine and pediatrics physician.
And what exactly is internal medicine?
Internal medicine, or internists, are physicians that take care of adults and their chronic medical illnesses. We usually take care of people from age 18 to over 100. And I'm also a board certified pediatrician who generally takes care of newborns to 18 years old.
So you're covering the full spectrum?
Yes.
Excellent, excellent. As you know, October is Breast Cancer Awareness Month. So why should we be concerned about breast cancer? And what is it? And can you tell us a little bit?
Sure. So breast cancer is one of the second leading causes of death in women.
Wow.
And breast cancer is cancer of the cells of breast tissue. It's something that I'm passionate about, and most physicians want you to get your breast cancer screening.
And so how do we get breast cancer screening? What is that? What does that involve?
So breast cancer screening is usually done at a mobile mammography van or an imaging center in your regional area, and you go in and they take images of your breast to detect breast cancer.
Who gets the mammogram? Is there a certain age?
Yes, there are guidelines, and it's so important that people get breast cancer screening, because breast cancer screening is the way that we prevent cancer, or we detect it early so we can cure it quickly. You start getting breast cancer screening at the age of 40. Some people who have a high risk or who have had first-degree relatives in their family with breast cancer get their breast cancer screening earlier. And those people specifically are usually recommended by their doctors to when they should start. But the general population of women should start getting their breast cancer screening at the age of 40, and they should get it annually.
Okay.
But in Ohio, you can go to any mobile mammography van, any hospital, and they will give you a screening mammogram without an order from a physician. You don't have to have a primary care to get a breast cancer screening, but it's important to have a relationship with the doctor so they can help you interpret your results.
That's good. And speaking of mammography, there's something that you've started doing around your birthday. Can you share a little bit about that?
Sure. So I have what I call my breast birthday ever.
Okay.
And most people, when they hear that, they're like, breast birthday ever? But yes, my breast birthday ever. Every year around my birthday, because I'm a primary care doctor and I work in the office for a healthcare system, I have the mammography vans come, and we have a DJ, and we have music, and we have chair massages, and we encourage women in our community and around to come get their mammograms, and it is a good time. We started off, I wasn't able to get my first mammogram when I was 40 because I had got a surprise blessing and I was pregnant.
All right.
So we started off when I turned 42, and the first year we did it, and we got 20 women, or 38 women to come get. The second year we got 68, and this last year we got 81 women to get breast screening
That is awesome.
At my breast birthday ever.
That's
awesome. Super fun. It's a great community event.
Excellent, excellent. And what month is that?
It's August, and I actually have the date for next year. We're going to have it next year on August 26th.
Can you share where?
It is it's at Mercy Health Forest Park. It's at the corner of Wynn Road and West Kemper.
Okay. Well, thank you so much for sharing with us today. Today we have on the show Patty Adams. She's a nurse practitioner, and she is a breast cancer survivor. So Patty, tell us a little bit about yourself.
I've been a nurse practitioner for about 25 years, and in that time I've been completely in the field of cancer and cancer treatment, and especially with breast cancer patients.
Okay. So how did it happen, or how did you discover the breast cancer?
Well, I was getting my annual mammograms every year, and when I was 47, when I got my routine mammogram, there was an area of suspicion, and they asked me to have a biopsy.
So what were your thoughts at that point?
I think the normal human thought is there's some fear, even though the possibility that it could be cancer But the important thing was I needed to know what it was. Peace of mind, so you know what to do next.
And what did you do next?
I had the biopsy, and it did reveal that I had a type of cancer that needed removing, so I had it surgically removed, and then went on to some pills for 5 years afterwards.
Okay. And how has the course been since then?
After the 5 years, then about a year after I had completed, I was having my mammograms every year. They found a suspicious area in where I had the surgery before, and so we rebiopsied, and they found another breast cancer.
Was it the same type or a different type?
It was a different type. This one was what could spread to other parts of the body.
Okay. And you took care of it along guidelines.
Right.
Okay. And so what were your thoughts, with this second occurrence? I mean, what was running through your mind with some of the emotion? I mean, did you want to go run and hide? Did you face it head on?
I faced it head on, and after meeting with a surgeon and a plastic surgeon, we both decided that the best treatment for me would to have both breasts removed, because there was other areas of concern in both breasts. So better to have it taken care of, and now I am 9 years from that surgery.
Awesome, that's excellent. So what would you share with someone that may be going through that same situation where they have an abnormal mammogram, and what type of advice would you give them or encouragement?
Well, I think the main important thing is that you have to find out what's going on, because the longer you wait, fear develops, and it just gets bigger and bigger, and in a lot of cases it's something that you don't have to worry about at all. So why not take care of it? And that's my advice. Do it and get it done, so you know what you have to face.
Excellent, I like that. Do it and get it done. Thanks, Patty, for joining us here on Being Health.
Welcome to Be in Health and our healthy eating segment. My name is Lynn Gotzi, and we are here today with Chef Anthony. Welcome, Chef Anthony.
Thank you.
Thank you for being here with us today.
Thank you for having me.
Oh, it's our pleasure.
My pleasure.
So we're going to be talking today about healthy eating for October, our breast cancer month. And he's just going to show us a dish that we can do as far as some healthy eating for breast cancer. But first, can you tell us a little bit about yourself?
Just Anthony Jordan of Invito Personal Chef Service, just built around being health conscious and just helping the community, helping people just stay fit from the inside out.
Awesome. Yeah. And just to tell you a little bit about our connection, I met Chef Anthony actually as I was working out. And he brought his card into where we were working out and prepared some meals for myself. Excellent chef, so I'm sure he's going to bring great things for us today.
I'm going to try to do my best.
Okay, show us what you got for October.
Today, just for October, Breast Cancer Month, I'm doing something, usually the theme is pink, so we're going today with Atlantic fresh caught pink salmon, rolled in a sun-dried tomato wrap with lettuce and a Goya mayonnaise. And awesome. I'm going to demo that for you right quick. All this, we're just going to keep it simple. Fresh is simple. We got the sun-dried tomato wrap, Goya mayo.
So what is in your Goya mayo?
Secret, ancient Chinese secret.
Is that personally made? Is that something you make, or is
something? It's actually a vegan mayonnaise,
okay,
which has no dairy in it, with a Goya seasoning. Goya seasoning is kind of Hispanic seasoning that my mother just threatened me and made me find one day.
Okay.
And I've been using it ever since.
Is it spicy?
No.
Okay.
It has a lot of it's awesome.
Okay.
You want to check it out. You want to. You add it to everything. I add it to everything.
Awesome.
And the cool part about it is, for color effect, it turns things orange. So
okay.
I like that too.
All right.
So we got the lettuce, iceberg. You can actually use any type of lettuce you want.
Okay.
A lot of times I'll use mixed greens, what we call power green set.
Okay.
These are Roma tomatoes, which are smaller, a little bit more intense in flavor. We got your pink salmon, which has been seasoned with I use a Montreal season, and it's real simple. And we got some gold veggie vegan mixed cheese. So we're gonna throw in there just a little bit like that.
Okay.
Boom. Nothing serious. Again, health is simple.
And do we serve this hot or cold? Or can you do it either way?
Either way,
Okay.
I would prefer cold. And
That's
there you have it.
beautiful. That's beautiful. And it's pretty simple. How long does that take to make? So say I have a family member who I want to prepare this for because they have breast cancer. Things are busy. Life
10
is
minutes.
crazy. That's a 10-minute
10
meal?
minutes.
Okay.
10-minute meal, you
Okay.
out, you back to the gym.
Okay.
You back to the
All
gym.
right. All right. We're back to caring for my loved one.
Yeah.
Okay. Sounds
Or
great.
yourself.
Yeah, that's true. That's
We
true.
need a break too.
That's true. So can you tell us just a little bit more about how you prepared the salmon? Was that something you baked? Was
The
it?
salmon was baked.
Okay.
Again, it was baked. I seasoned it with a Montreal season. Montreal season is coarse sea salt, pepper, red pepper flakes, and garlic.
Okay. Any oil used in that cooking?
Just olive oil.
Olive oil.
Just
Okay.
olive oil just to coat the pan and keep it from sticking, and you have to scrub the pan and do a whole bunch of work after it's done.
Awesome. Awesome.
Yeah.
Well, we thank you so much for bringing that to us for October. We appreciate your time.
Thank you for inviting
And
me.
hopefully we'll see you next
Appreciate
month.
it. Yes.
All right.
Be-
And joining me today are Deonda and Michelle. These ladies both work in healthcare administration. So the question is, how does finance impact one's health? Deonda?
I think it's a very, very big concern in the healthcare industry with finance. There are those who may be just above the level for Medicaid to be accepted for that. So they would have to pay out of pocket for a lot of their expenses as far as their medical care, their medications, and especially if they have any chronic illnesses that are just too much money to cover everything. It's hard to pay for that. And then if someone is lucky enough to have insurance through their employer, still sometimes the deductibles are just insanely impossible to reach, especially if you really don't have too much wrong with you to really use it up. So that can really impact your finances there.
Very good, excellent points.
Yeah.
So Michelle, how do you feel that finance impacts one's health?
Finance can impact someone's health by the way of life.
Mm-hmm.
A lot of people like to eat healthy on a regular basis.
Mm-hmm.
So I believe just having like organic foods versus fast food is a good way. And I know that having organic foods or healthy foods is more expensive than having fast food. A lot of people also like to pre-prep their food for the week so they know what they're going to eat. It's also a way to save money because sometimes we have a tendency, even though we may eat healthy, we will have like a urge for something, like a snack or something sweet. So it's just good knowing that even though the finance can affect it, knowing that you're eating healthy in the long run and it's going to benefit you in the end.
Okay, very good. And of course, we know that if a person's in a stressful situation with their finances, they may have some physical manifestations of that stress, be it from ulcers to difficulty sleeping. There could also be challenges even within the relationships.
Absolutely.
And adding another layer of, again, stress and increased blood pressures, making it harder to manage, even difficulty controlling the blood sugar. So we do want to give some pointers and some tips to the general public on how we can improve our finances, and maybe we can also impact one's health additionally. So Michelle has a knack for finance. So Michelle, what pointers can you share to help with our finances?
Some of the habits someone could develop to be financially stable and also successful is to control their impulse spending. A lot of people have a tendency in which they like to just purchase items just randomly, would like to do retail shopping, retail therapy. So just watching what you spend on a regular basis. For example, whenever someone gets paid on a every 2-week basis or weekly basis, just use the envelope system in which.
What exactly is the envelope system?
The envelope system is you take funds out. It can be $20, $30, $40 to $100 out from your paycheck, and you can use that for anything. It can be for food, for therapy, shopping, anything that you would like to do is deducted from your original income that you have set, and in that way it's not affecting any of your bills that's coming in for the month.
Okay. So what if I get to the end of it before the next paycheck? Let's say I get paid every 2 weeks and I'm finished, I'm out of that money on week 1.
Well, I would say you just have to set boundaries for yourself. And knowing that you have those boundaries, when the money is gone, that's it until the next time you get paid again. So just having that mindset and that frame of mind.
Okay, very good. Anything else that
Yes.
we can do to kind of...
Another one, it's just investments and retirement. A lot of people in their 20s have a tendency to not think about retirement. If you work for a particular company, most companies have 401k or 403b. So it's a good way to just invest your money long term. Also, if someone gives us money for our kids, for their birthdays or our anniversary, we can actually ask them to invest into a stock or bond for us, like Microsoft or Apple, depending on what you like. And in that way, it's another way of retirement.
Okay, excellent.
Now, I know personally, I'm not really good at writing things down and trying to plan out a budget. So is there like any apps that I could possibly download that can help me do that? Because I am almost attached to my phone.
Definitely. There are several apps that you can get on your on the Apple Store and also on the Android Play Store. There's some that's Mint, Speedy, or even Every Dollar. A lot of times you can just type in monthly budget on there on the app, and a variety of them comes up. Some of them you can pay for, and majority of them are free.
Excellent.
That's my favorite word.
Free.
Free.
Yes,
Free
free.
is always nice.
Yes.
Awesome. Any other questions for Michelle? Any other tips that you would have to help us more financially stable? We know that it can be a challenge, and sometimes our financial situation changes. We didn't see the divorce coming. We didn't see the bankruptcy coming. We didn't see losing the job and losing the income. So a lot of situations can come up that we didn't see, so we didn't plan for.
Right.
And so we want to provide some helpful tips on how you can improve your financial situation. If we can perhaps improve the financial situation, maybe we can also improve and take care of the health a little bit better as well. And continue our conversation on breast cancer, I'm sharing some information that's taken directly from the CDC's website. You can log into the cdc.gov and search for breast cancer and get a wealth of information about breast cancer. But breast cancer, basically, there are disease cells of the breast that grow out of control. It's the second leading cause of death, cancer death in women, but the leading cause of cancer death in Hispanic women. Black women have a higher risk of death than white women, typically because of being diagnosed later in the disease process. In the U.S., there are roughly 237,000 women diagnosed with breast cancer and 2,100 men diagnosed each year. 41,000 women die with breast cancer in the U.S. annually, and 450 men. The risk of breast cancer increases with age, with the average age for women being 61. Men are usually diagnosed between the ages of 60 and 70. So what are the symptoms? The symptoms might include a lump in the breast or the armpit, thickening or swelling of part of the breast, dimpling or irritation of the breast skin, redness or flaky skin in the nipple or breast area, pulling in or retraction of the nipple, or pain in the nipple area, any change in the size or shape of the breast, and pain in any area of the breast. Risk factors that are unchangeable include being older than 50, having certain genetic mutations, specifically BRCA1 and BRCA2 genetic mutations, the reproductive history, either starting periods under the age of 12 or reaching menopause after the age of 55, having dense breast tissue as it's harder to see breast cancer on mammograms with dense breast tissue, having a personal or family history of breast cancer, having previous radiation treatment, and women who took the drug diethylstilbestrol during pregnancy from the years 1940 to 1971. There are some changeable risk factors, and they include physical inactivity, being overweight or obese after menopause, taking hormones, either hormone replacement therapy or oral contraceptives, the reproductive history, for example, having the first child after the age of 30, or never having a full-term pregnancy. Also, drinking alcohol has been shown to increase the risk. We can reduce the risk of breast cancer by maintaining a healthy weight, having regular exercise, and we should discuss hormone replacement therapy or contraceptives with our healthcare providers. Also, breastfeeding if possible. For breast cancer screening, you should have a discussion with your healthcare provider. This is based on risk